to Health and Wellbeing, your go-to program for all things related to maintaining a healthy lifestyle. I am your host, Lois Apasambo, and today we have an important topic to discuss: hypertension. Yes, hypertension, also called high blood pressure, is a condition in which the force of the blood against the artery walls is too high. About one-third of adult Nigerians are said to be living with hypertension, with only half of them aware of their status. And recent figures also suggest that more than 76.2 million Nigerians are living with hypertension, and many more are expected to develop the disease. High blood pressure affects millions of people worldwide, and it's crucial to understand how to prevent and manage this condition. To shed light on this topic, today on the program we have Dr. Ifeoluwa Oshinusi, and he's joining us on the program. Thank you very much, Dr. Ifeoluwa, for being on the program.
Thank you. It's a pleasure being here.
And it's nice having you here. So talking about blood pressure, or what we call hypertension,
Okay.
I'd just like you to explain the condition for us, in layman's terms, because I don't want to use so many big big medical terms. Yeah. So in layman's terms, how would you explain the condition of high blood pressure?
Okay. So basically, hypertension, like you said, is elevated blood pressure. So in your circulatory system, you have your heart that is pumping blood to your vessels, your arteries, your veins. Now, when this pressure inside your arteries or veins is a bit high, you look at hypertension, and there are certain values that it has to get to. So explaining it in using layman's terms, I will talk about what most of us have in a house is a pumping machine. So a pumping machine pumps water to the taps in your house, right, through the pipes. Okay. So if the pressure within those pipes is a bit much, you expect that the pipe could actually break, or the pressure in your taps when it comes is going to be high. Now, if you are washing your plates or you are washing your clothes, if the pressure is too high, it can actually damage your clothes. So that's how hypertension is the pressure within the blood vessels, and that's how blood is passing through. So when the pressure is a bit high, then you say it's hypertension. So there are certain values that we look at in the clinic.
So what is the average rating for blood pressure? Because I know that there are numbers attached to it and there's a rating. What's the average rating for that?
So the average rating for hypertension basically is at 140 or above, over 90 or above. So the 140 is systolic blood pressure. That is the pressure that comes from the heart as it's pumping. That's what you call hypertension. So the normal blood pressure is between 90 to, or there are different school of thought. So some will say 90 to 130, some will say 90 to 120. That's the systolic, the top one. Over 60 to 90, that's the down one. But because of the prevalence of hypertension, some associations are trying to bring it down. So they talk about pre-hypertension. And some people say it starts from, some school of thought say it starts from 120 to 130, rather to 140. Some say it starts from 130 to 140. So, but we look at if at 140. So, if somebody has 140 or above, over 90 or above blood pressure, then we call that hypertension. It's taken on two different occasions.
Okay. So the above, or the one up, or the one down. Explain what that means. So what's up and down?
Okay. So when you go to the hospital and they do your vitals, if you are very observant, you see that they will write something in a fraction form.
Yes.
A number, maybe 120 over 80.
Yeah.
So the number one is usually around that 120 over 80. So 120, the one on top, is the pressure from your heart. Remember my analogy of the pumping machine?
Yes.
So when the heart's like the pumping machine, so when it's pushing blood through the vessels, that's what generates the first one, the one on top. So if that one is over, it's 140 or above, then we talk about hypertension.
Okay.
Right. Now the second one, the denominator, which is the one under, which is usually between 60 to 90, or rather 60 to 89. At 90, it becomes hypertension. It's the pressure generated by the vessels itself. If you're looking at taking the analogy, like I said, the pipes, it would be from the pipes itself. So if the pipes are a bit smaller, right, you expect that the pressure will be higher, right, because the water is passing through. So if it's smaller, it has to have a higher amount of pressure passing through that pipe. So that's the one that's generated by the blood vessels, and that's one you see under. So if it's 140 or above systolic, or over 90 or above, which is called the diastolic, then you look at hypertension.
Okay, so what are the symptoms, that one would look out for to say, I think I'm having a high blood pressure? Because these are things that we don't see, Yeah. So what are the symptoms that you see and it's like, okay, I think that's high blood pressure?
Okay, so the thing is that hypertension has been termed the silent killer, meaning that you almost do not see symptoms until you have complications. And the funny thing is, or the interesting thing rather, that we see in our society today is that most people right here, they present with the complications of hypertension. It's not common for you to see somebody just come into the hospital for a routine blood pressure check. They usually come in with the complications, so you may not really see symptoms. The symptoms that people refer to as sometimes may be the complications, but there are some things that may point you towards hypertension. For example, if somebody is having severe headache, then the person may need to go and check his blood pressure. If somebody is feeling dizzy, vomiting. So I'll just briefly talk about the complications because that is what we usually see. Now, the blood vessels, like I said, they are the ones that transmit blood, right, to the end organs, to your brain, to your heart, to your kidneys, to your lungs for it to function. In hypertension, right, the pressure is increased. And because of that, the vessels have to adapt. So what they do is that they become thick. And because they become thick, the lumen, that is the opening that blood passes through within the vessels, becomes smaller. Now, this reduces blood supply itself to the end organs. So if you have reduction in blood supply to the brain, it could have, the person could come up with a stroke, right? If you have reduction in blood supply to the heart, the person could present with a heart attack. If you have reduction in blood supply to the kidney for a long period of time, the person could come down with what we call chronic kidney disease. Those are the macrovascular complications. That is the ones that affect the larger organs. So you talk about the microvascular, the ones that affect the end arteries. So you look at hypertensive retinopathy. So basically that happens in the eyes, in the retina of the eyes, and then the person may present with blurry vision, the person may even present with blindness, but it's a chronic thing, so it doesn't just go blind over time, it's gradual, right? And then for the other part, we talk about peripheral vascular disease, so the person may have what they call pins and needles on the legs. So the blood vessels, right, they supply the nerves that go to the body, right? Now, at the legs, if the end arteries that are supplying the nerves become narrow and they cannot really supply the nerves itself, what happens is that the nerves begin to malfunction, more or less, in layman terms, it begins to malfunction, and then you begin to feel pins and needles on the. I don't know if you know what pins and needles are.
Because I was going to ask, pins and needles, does it feel like you're being pricked on your toes? Or because when I hear pins and needles, I'm beginning to ask, does it feel, that, how do I explain it? Like some tiny things you feel like under your feet or something. Am I explaining it right?
Yes, something like that. It's more or less like, so people describe it as like electric shock or electricity coursing through your body. So you feel like something is choking you, or rather, let me know the word choking. Something is
piercing you, but choking is really the best word because people would understand it better.
So something is more or less piercing you, and it's just not so deep enough that you really feel pain, but you feel like something is actually going through your skin there. So basically, that is what we call pins and needles. So those are some of the complications of hypertension that we see people present with. But some of the symptoms, they are not really clear-cut symptoms, but since it doesn't really present with symptoms itself, sometimes it may present with headache, or they may present with these complications itself, sometimes vomiting, they may have altered mental status also, they may be a bit drowsy, they may be a bit confused when they come in. So these are some of the little symptoms that we see. Okay.
So what are the factors that contribute to the development of high blood pressure? Because I believe it doesn't just happen. Yes, are there predisposing factors to this?
No, very, very, very good. You look at risk factors, yeah? I guess that's what you're asking. Now, risk factors are not things that would actually cause it. Before I continue, I just want to say this. There are two types of hypertension. You have the primary hypertension and you have the secondary hypertension, right? The secondary hypertension is the hypertension that occurs from a problem in the body. That we can say this is causing the hypertension. Once you take this out, the person gets better. The blood pressure comes to normal, right?
So for that kind of hypertension, in what kind of situation do you have that kind of hypertension?
So you have that kind of hypertension in people that have many times congenital anomalies in the kidney. So somebody that presents with adult polycystic kidney disease, that's when you have a lot of cysts in the kidney. The person may present with hypertension. So if you deal with that, the hypertension will come down. Somebody that has a cancer, some cancers produce certain chemicals that will increase the blood pressure. So if you take care of the cancer, the blood pressure will come down. Some people, the thyroid gland actually helps to regulate blood pressure. So if the thyroid gland is malfunctioning, then the person may present with hypertension, right? So if you take care of that, the hypertension will come down. But what we see in a lot of people today isn't that kind of hypertension. We see the primary hypertension. That is the one that you cannot point out that this is the one, this is that's causing it. You cannot point out that this is the cause. It just happens. So it's something that has both genetic and environmental basis. So the risk factors for that, or the things that would actually cause that, you look at modifiable and non-modifiable. So what I mean by that is you have factors that you cannot modify. You are born with that, with those factors.
Yeah.
So you can't really change it, right? And you have factors that you can actually change it. Those are environmental factors that as you grow older, the things that you do, the choices that you make can predispose you to having hypertension. So the ones that are non-modifiable, right? Those are the ones that if you stand in the mirror, you look at yourself, you see certain things that you cannot change, right? You cannot change your descent, your skin color. If you're African, you can't change it, right? Right? You can't change it.
Naturally, you can't, because you see people do that here, but naturally, yes.
Yeah, you can't change the chromosomes, your genetic makeup of being African. Yes, you can't change that. Your sex too, you can't change the genetic makeup of your sex being a man, right? If you have a family member that has hypertension or has a particular disease, you can't change that factor because you don't have control over that. So those are the non-modifiable risk factors. The family, if somebody in your family, your nuclear family has hypertension, you are at a higher risk of having hypertension.
So it's also genetic?
Yes, it has some genetic basis, right? So if a family member, your dad or your mom, your siblings, somebody has hypertension in that family, you are at a higher risk of having systemic hypertension, right? So also then sex. Men are more likely to have hypertension than women, right? Then you look at your color, your skin, well, not really your skin color, your descent. So Africans have a higher tendency to have hypertension compared to white people. And then you look at age. So above 65, you are at a higher risk of having hypertension. So those are the non-modifiable risk factors. So you can't really change that. You can't change your age. You can't change your sex, your family history. You can't really change those things. So the things that you can change, which are the non-modifiable risk factors, right? Those are, well, the first thing you talk about is your lifestyle. How do you live? Now, what do I mean by lifestyle? Basically, you talk about alcohol intake. So some school of thought, so some studies have suggested that there is no safe amount of alcohol. Because alcohol is a risk factor to so many diseases, and one of them is hypertension, right? Then smoking is another risk factor for hypertension. So if you don't smoke, if you don't take alcohol, that will reduce your risk of having hypertension. Then you look at, do you exercise often? Do you just sit down basically at home and for the whole day you don't exercise? Those are risk factors. So if you don't exercise often, that's a risk factor for hypertension. If you're overweight or obese, then you look at, that's a risk factor for hypertension.
As well. Okay, so talking about lifestyle, because for so many diseases, especially non-communicable diseases, one of the major things that advocacy has been made for is, don't live sedentary lives, So what kind of lifestyle changes would you advise that people have? Someone may tell you, I don't take alcohol, I don't drink, I don't smoke, and I try in exercising. It may not be as much as I would want to, but I'm down with high blood pressure. What can that kind of person do? Okay, so people like that, well, the person doesn't drink, doesn't smoke, right? But he doesn't like exercising. Just a little. He tracks a little bit, a few distances.
Okay, so the expected amount of exercise you're supposed to do in a week is 30 minutes of aerobic exercise. That is either you walk fast or you jog 30
every
minutes.
Week?
No, you do that three times
day?
Every week,
Okay.
At least 3 to 4 times every week. So you do that 3 to 4 times every week. But to be realistic, especially in our country, you may not really have that time to do that because even in Abuja now, most of the people in Abuja, or a large percentage of the people in Abuja, are civil servants. So you go to office by 8, you come back by 4, 5, you eat, you sleep, you go to office again. So you do that, it's like rinse and repeat. You do that routine. So Monday to Friday, right? But what you can do, they can help you, and I've seen that actually work, is that if you're in your office, right, you can actually do some amount of exercises, right? You can actually walk up and down. You don't just sit down in your office and or maybe type, or you walk up and down, see what people are doing. I noticed that I have a colleague rather, where I was working before, right? He was adding a lot of weight prior to coming to that place to work. Yeah. So he didn't actually exercise. So what he did was, where I was working before, there was a place that you can play football. That is around from between 4 to 6. So we always play football then at that time. So what he was doing was that he played football 2 to 3 times in a week because he actually likes football, right? And then during working hours, he was always walking up and down because it's the hospital now. So you have to walk from here, walk from the ward to the lab, from the lab to the theater, and places like that. So he noticed that within the next 3 to 4 months, right, he actually lost some amount of weight. Yeah. Right. But if you just sit down in your maybe your office and you don't really exercise, you're not going to lose weight. And weight is almost directly proportional to blood pressure. So if you reduce your weight, your blood pressure is going to come down, right? So if you just sit down in your office, you don't work, you don't try to exercise, it's not really going to work. So you have to at least do some level of exercise. You have to sweat. If you can't sweat, if you don't want to sweat, well, you have to take a long period of maybe walking, just normal walking, 2-3 hours in a day. It will help. Then for the dietary approach, well, there's something called dietary approach to stopping hypertension, DASH diet. So we use that for people who have hypertension because studies have shown that the dietary approach plus pharmacological approach, which is the drugs, actually work synergistically. So they work hand in hand and they work very well together. So to prevent hypertension, you can also use that diet, right? So the diet basically means that you have to eat healthy. So you have to reduce the amount of salt that you take, 2 to 3 teaspoons of salt in a day, right? So you don't just carry like a whole spoon of salt and then you pour, because you see a lot of people doing that. And most of the meals that you purchase outside, they put a lot of salt in it. There are some places that I know that I always try to avoid because I know that once you taste the food, you know that the salt is plenty. You already know. Then you look at sugar. I've seen a lot of people come to the hospital and they tell you that they take 3-4 bottles of Coke every day. I mean, that's quite a bit much. So you have to reduce. If you cannot totally stop taking carbonated drinks, you have to significantly reduce the amount of drinks that you take, right? You have to reduce the amount of Coke that you take, Fanta, Sprite, all those carbonated drinks, you have to reduce them, right? And then you look at fats, saturated fats. So you have to, if you take palm oil, because I know a lot of people, where I was working, a lot of people like beans and bread. That was like the common
staple food.
That was like normal food in the morning. So you wake up in the morning, you go and buy beans and bread. So people eat it twice in a day, in the morning and in the night. And if you look at those places that cook beans and bread commercially, right? They use a lot of palm oil. Apparently, maybe it makes it sweet. People like it. So you can even, the oil that they use, you can use that oil and fry maybe a crate of egg. So they put a lot of oil in their beans, and then you can see that they have a lot of issues with it because the palm oil contains about 50% of saturated fats, which you are trying to avoid.
Yeah.
Now, when you take too much of fat, right, it gets to the point that this fat begins to build up in your blood vessels. I remember why I said that if the vessels become narrower, become the place where blood passes becomes narrow, the pressure is going to increase. So that would definitely or most likely would increase your blood pressure. So you have to reduce fatty food. So you can take things like fish, you can take things like chicken. You remove the skin from the chicken because the skin contains a lot of fat. So you remove the skin and you take chicken. And be careful the food that you use to fry, the oil that you use to fry your egg or your chicken or whatever you use to fry it with. Okay. And take a lot of vegetables and a lot of fruits.
Okay. Really that's good for the exercising and then our diet. Well, we'll just take a short break and then we'll just give you some exercises that you can do on a regular and some foods that you can have by the side just so that you're able to work on your diet and on exercising as well.
Fasting workout helps to regulate the blood. And one of the things that cause problem in our health is when your blood is not regulating. You will start developing different issues in your body. Like, for instance, you're not sweating, I know what it means. You're not burning calories, I know what it means. So these are one very, 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 very good essential benefit of workout. I'm going to be showing you guys few workouts you can do at home at your own convenient time, at your bedroom, at your parlor, even at your surroundings. So just few of it that you can do and it'll be nice. So we are going to start with jumping jack. Take your body and keep your hands firm. Then you go like this. This is another one you can also do that is very nice. So you put on the other legs. After you do some up straight workout, you try to go down. You go on a mountain clamp, T-clamps. Do something like this. Get a balance, and you come up like this. So after running all of this, you try squatting. Then you try to go, you stretch your body, touch your toe like this. Then you come up like this. Go like this. Come up like this. Come up like this. So you double bounce and you squat. 1, 2. Let's go. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. Yeah. With this 5 workout, I believe your body will be very, very fit and it will help you go a long way. Keep it up.
Once in a while, you may have received comments that your body resembles the shape of a pear, an apple, or maybe a carrot. It sounds silly, of course, comparing one's appearance with a fruit or a vegetable. However, on the contrary, there are certain foods that actually resemble certain body organs. Not only just that, consuming them can also contribute significantly to their health. Here is the list of some foods and their associated health benefits. Walnuts and brain. Walnuts resemble the right and left hemisphere of the brain. No surprise it is called food for the brain. The human brain is composed of about 60% structural fat and it requires high-quality fatty acids to keep it fluid and flexible. The cell membranes are made of essential fats including omega-3 fatty acids. They keep the membranes flexible and promote the flow of electrical impulses. Walnuts are high in omega-3 fatty acids, which enhances the functioning of the brain. Research has further revealed that these brain-shaped nuts also help in mitigating cognitive decline with age and lower the chances of premature death. Carrot and eyes. Slice a carrot into half and you'll see that it resembles the texture of the human eye. Well, the old wives' tale about how it contributes to its health is actually true. Carrot is rich in beta-carotene, a carotenoid which is converted into vitamin A, a vital antioxidant that damages free radicals from the eye cells and the rest of the body. It protects the eye from common nutritional deficiencies that can lead to loss of vision, and research says that the compound beta-carotene is inversely related to lung cancer incidence. Ginger and stomach. The ginger root looks similar to the stomach and is a hot and spicy way to treat digestion problems. Ginger is great for you if you have a sluggish digestive system, as it effectively cures an upset stomach, eases motion sickness, and relieves you from flatulence. Research shows that acetone extracts of ginger aids in bowel secretion, which boosts digestion. If you otherwise don't include it in your recipes, an easy way to enjoy its benefit is by making ginger tea. The first sign of nausea you receive, just drink a cup of ginger drink and it will be gone in no time. Tomato and heart. When you slice open a tomato, you will see that its multiple chambers resemble the structure of your heart. Tomatoes could save you because they are rich in an antioxidant called lycopene, which according to research can reduce cholesterol levels within a week, thus lowering the risk of heart disease. Another study further associates them with reduced occurrence of prostate cancer. Plus, tomatoes are cholesterol free, so it anyways do not add up to the building of plaque in your heart. In fact, rich in vitamin B3, it helps to lower the level of cholesterol in your body. Plenty of reasons to indulge in a tomato-rich salad. And lastly, womb and avocado. Resembling the structure of a uterus, avocado is one of those fruits which contain healthy fats, boosting our overall health. For pregnant mothers, this is a must-eat as it contains folate, which boosts reproductive health and fosters the growth of the fetus during pregnancy. Folate, a member of the vitamin B group, is naturally found in green leafy vegetables and fruits. It is much healthier to consume folate from natural food sources than from folic acid supplements, which are oxidized synthetic compounds. Fruits like avocado are a safe bet when it concerns your reproductive health. Moreover, this fruit is also rich in omega-3 fatty acids, which are healthy essential fats you can reward your body with. but due to its high calorie count, it is wise that you stick to not more than 1 avocado per day.
Welcome back and thank you for staying with us. If you're just joining us, this is Health and Wellbeing on ASO Television, and we've been discussing hypertension with Dr. Ifeoluwa. Before we went on the break, we're talking about exercises and diets, and then there was one question I wanted to ask. Are there exercises that people with high blood pressure should avoid? Because I know that when you exercise, there's a lot of pumping of blood, and if you have high blood pressure, it means that it's going to pump more, So are there kinds of exercises that people with high blood pressure should avoid?
Okay, so the first thing I want to say is that before you embark on certain exercises, as a patient with hypertension, you should first see your primary care physician. You should see a doctor, because there are certain tests that we run on people with hypertension to rule out certain complications if they already have them, and then they would advise you appropriately on what exercises you should avoid. So I won't answer that exactly here, but I'll just tell you that it's best to see your primary care physician. It's so important to see them before you embark on certain exercises.
No, because obviously there are some that you should avoid if you have high blood pressure.
Yes, some you should avoid.
Okay. So let's talk about the complications of high blood pressure. I know you just mentioned them in passing, but what other complications could come up from high blood pressure?
Hypertension. You have to look at they're divided into two. So microvascular and microvascular. So you look at the effect on the large organs in the body. So you look at the brain, right? The brain, the heart, the kidneys. We had a consultant back then in school that always says your head, your heart, and then you look at your stomach. So your head, the brain is located in your head, right? Mm-hmm. Your chest, it's located in your heart is located in your chest, and then you look at your stomach, your abdomen rather, where your kidneys are. So now we start with the head. You see, the problem with hypertension is that the complications are so severe that we can manage them here, but we don't have many centers that can manage them appropriately here in Nigeria. It's not like in other developed countries that you can get an ambulance immediately, they'll take you to the hospital, and then you can easily get the care that you need immediately without even spending so much money, right? But here we don't really have such facilities in many places in the country. So some of the complications, I'll start with the first one. Like I said, the head, you look at stroke. We call it cerebrovascular accident. So the person has sudden onset of neurological deficit from vascular origin. What that basically means is that person just suddenly has a deficit in his neurological system. So usually what we see is motor system, meaning that the person may just have inability to move his hand or move his leg. It just happens. So that's what we call a stroke. Or it could present in form of slurred speech, so the person may not be able to vocalize properly. So there are different syndromes or different symptoms of stroke. It's not just inability to move your hand or the ones that you commonly see. There are so many types of stroke that we see, so many features of stroke that we see, but the common ones are the ones I mentioned. So, and the problem with that particular complication is that ideally, right, the person is supposed to get to the hospital within 4.5 hours, so that's like 4 hours, 30 minutes after the onset of the event, so that he can get the care that he needs. So they can thrombolize him or they can remove the clot itself. But we realize that if somebody has a stroke, God forbid, let me say at a party, before the person gets to the hospital, and then you have to look at the fact that can the hospital actually take care of the person with that with stroke. We saw, when I was working before, we saw so many patients that presented with these symptoms, some of them even before the time before that golden hour. And we couldn't really do much because the facilities were not there, or the patient did not have enough money to do that. So that is why we should be practicing preventive medicine. That's what we're actually doing now. Preventive medicine. Let's prevent this complication. So the first one is stroke or cerebrovascular accidents. Now the second one is, which is a very major one, is heart attack. We call that myocardial infarction. So what happens is that, like I said, in hypertension you have a reduction in blood supply to certain organs in the body. Now, in people that have that, I talked about the fact that sometimes fat can build up in the vessels, right? Sure. Now, if that's build up just ruptures all of a sudden, and then it goes further to occlude or to close the artery at the point where it's supplying blood to the heart cells, the heart is going to die. That part of the heart is going to die because without blood supply, without oxygen, we expect the heart to die. I mean, that organ to die, whatever the organ is. So the heart is an organ in the body. So it will actually undergo what we call ischemia, then infarction, and then it will die. So what that happens is the heart cannot pump blood enough. It cannot pump enough blood. So what happens is that the blood cannot get to the brain. And when the blood cannot get to the brain, the person falls down. And the person, in some cases when you cannot take the person to the hospital immediately and for them to take care of that immediately, the person may pass on. right? There are other complications that you can see, even within the heart. We call that heart failure. So when the heart is trying to pump, because it's pumping against a very high pressure, so it's trying to pump blood towards that pressure, right? The heart undergoes what we call hypertrophy. It's like you going to the gym. You start lifting very heavy things, right? Your hands are going to get bigger. Your chest is going to get bigger. You start actually getting bigger,
yes.
right? So that's what the heart does. But it's kind of counterproductive because the heart, as it is increasing, where the blood enters into the heart, the space that the blood occupies in the heart, where before it pumps out, becomes smaller. So the heart cannot actually pump enough blood to supply the demands of the body. And we call that heart failure. So when the heart cannot do that, the heart starts beating fast. So some of the symptoms that you may see in hypertension, which is now a complication, is palpitation. So the person is feeling his heart beating, doom, 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 doom. That's because the heart is trying to pump at a very, very high force to try at least overcome the pressure, which is in the arteries. So when that happens, the person may have heart failure, and that's really not good because then you begin to see fluid build up in the organs in the body, build up in the legs, in the chest, and the person may have this cough that it doesn't want to go. Then you look at the kidneys, right? Now, reduction in blood supply over a very long time will cause what we call chronic kidney disease. So the units of the kidneys are called nephrons, and they do not regenerate. So because of that fact, right, so when they die, they are not replaced, right? So with reduction in blood supply, some of them begin to die off. So when somebody has chronic hypertension for a very, very long time and it's not controlled, right? All these things are usually from uncontrolled hypertension. So if it's controlled, the person will unlikely have any of these symptoms at all, right? So if it's uncontrolled and it's very severe for a long period of time, the nephrons will die, which is the functional unit of the kidney. And because of that, the kidney's ability to filter urine, to concentrate urine and to do its functions will be lost. So when it's lost, you have chronic kidney disease over a period of time, right? And then it gets worse because the progressive thing, it gets worse. If the person doesn't still control the hypertension, it can lead to end-stage kidney disease. And then you're looking at dialysis, you're looking at doing that 3 times in a week, and that is so expensive because some places they charge as much as 80,000 and 100,000. So imagine per dialysis. So imagine you spending 300,000 in a week. So that is more or less like almost a million in a year. I mean, that's like
a million in a month. How much are you making?
That's how much are you making? So you look at that. That is I don't know. It's a problem because that's why we're practicing preventive medicine, because realize that you can't actually. It's difficult to solve these problems. So now you look
because I was going to ask, is it curable?
Yes, the hypertension isn't, well, you can control it. The thing is that everybody has a risk, or based on those, not everyone, if you have a risk factor, meaning that you are a Nigerian, so most of all, at least once you are a Nigerian, you are of African descent, you have a risk, you stand a risk. You are not a man, you have a risk. You have somebody in your family that has hypertension, you have a risk. You are above 60, 65, you have a risk. So that's like 4. So it's not something that I would say it has to just totally cure, because the risk factor is always there. So you have to keep preventing it if it hasn't gone to that stage, or manage it if it has gone to that stage.
So once it gets to this stage, your blood pressure can't come back to normal again?
It can actually, if you take care of it, if you use the drug. So when you have hypertension, you see your doctor, right? Your doctor would then either prescribe medications for you or tell you to change your lifestyle, stop smoking, do exercise regularly, and review you maybe in a month's time, in some weeks' time, review you like that and see if those things are actually working. Once those things are working, your blood pressure may never get to 140 over 90. So you practically live a normal life without any of these complications. So once you manage it properly, if it gets to that point, you basically begin to take the diets that you are told to take, you take the drugs that you are told to take, you almost will not have any of these complications, basically, right, as a result of hypertension, because the blood pressure hasn't gotten to that point. So I wouldn't say that it's something that you would cure, because the risk factor is always there. So what you do is that you manage the risk factor. If it gets to the point that it's already elevated, you see your medical professional, right? And your medical professional will not then tell you, probably you should start doing exercises. He has not gotten to the point that you use drugs, or he may prescribe medications for you and then review you. So I think basically you would follow up with your medical professional or the medical doctor taking care of it to know what next to do.
Okay, so we're talking about preventive medicine, First step I believe we should all take is always check your blood pressure. How often should we check our blood pressure?
Well, there are so many schools of thought on that, but you have to look at the Nigerian setting, because if you want to check your blood pressure, you have in many places you have to pay. If you cannot afford to buy this automated, we call it sphygmomanometer. So that is the machine that you use to check blood pressure. That thing that you wrap around your hand.
Your
right?
hand.
So if you can't basically get that you can't afford that. Maybe you would have to see your doctor first. It depends on the blood pressure you get at your presentation at the clinic, but you should check it as often as you can. If you can check it every day, that would be very, very good. If you can even check it twice a day, in the morning and before you sleep, that would be good. But you should see your medical, your physician, your primary care physician, and he will then advise based on what you are getting in the clinic. But every adult that is a Nigerian that is here, every adult basically should at least try to check his blood pressure every day.
Yeah, we should, because there's a lot we're going through, as Nigerians, everyday life and all, and the struggle. So it's not so easy. But thank you, Dr. Ifeoluwa, for taking out time to be here with us on the program. But before we wrap it up, I'd just like you to give a word of advice to our viewers out there.
So I would say that hypertension isn't really a big deal. It isn't really a problem. The burden of hypertension is quite much. The WHO says that about 1.28 billion people are living with hypertension, and the burden is basically in low to middle income countries. So basically countries like Nigeria, and half of these people don't actually know that they have hypertension. So my advice to everyone is that check your blood pressure as often as possible. If you can check it every day, please do so. Try to go to the hospital and check your blood pressure. If you cannot get the machine at home, check it. And once you see a reading of even 130, 140, please try to see your primary care physician. It's so important. And try as much as possible to live a healthy lifestyle. If you smoke, try to stop smoking. Try to reduce the amount of alcohol you take. Try to reduce the amount of salt you take. Try to exercise as often as possible, because those are the things that would help prevent hypertension itself. They will help control it if it has already started.
Thank you very much, Dr. Ifeoluwa. We sincerely appreciate your presence on the program today. Thank you. Well, that's how far we can take on the program today. Remember, be mindful of your lifestyle, because healthy lifestyles can help keep blood pressure low and protect against heart diseases and other diseases such as stroke and kidney disease as well. Well, for questions, suggestions, and comments, you can reach out to me on my social media handles on the screen right now, and keep it a date with us 5 p.m. next week, Thursday. I am Lois Apasambo. Do stay safe.